According to the Nigeria Center for Disease Control (NCDC), the use of a face mask and the other non-pharmaceutical preventive measures on COVID-19 will contribute quickly to controlling the coronavirus outbreak. 252 confirmed cases were reported in the last 24 hours from 17 states, and the FCT Plateau recorded 50 cases, 35 in Enugu, 27 in Rivers, 26 in Lagos, 18 in the FCT, 18 as well in Kaduna, 10 each in Ekiti and Kano, 9 in Taraba, 8 each in Anambra, Edo, Oyo, 7 in Delta State, 6 in Ogun, while 5 each in Abia and Bayelsa states, and 1 each in Ebonyi and Osun states. 707 discharges have been reported in 14 states, and the total confirmed cases in the country stands at 52,800, with 39,964 discharged and 1,007 deaths recorded. Now, Nigeria's President Muhammadu Buhari has presided over the Federal Executive Council meeting, swearing in newly appointed permanent secretaries and other government officials at the State House. It was the 13th virtual Federal Executive Council meeting since the outbreak of COVID-19, with some ministers physically present at the council. Now, some of them include the Minister of Niger Delta, Godswill Akpabio, the Attorney General and Minister of Justice, Abubakar Malami, Minister of Information and Culture, Mr. Lai Mohammed, Minister of Finance, Budget and National Planning, Mrs. Zainab Ahmed, Minister of the FCT, Mohammed Bello, the Minister of Water Resources, and others. Now, the head of service of the Federation, Yemi Esa, and a few other ministers attended virtually from their various offices. In the meantime, the 60th Annual General Conference of the Nigeria Bar Association, NBA, which is the largest gathering of lawyers in the country, held virtually for the first time today in Lagos due to the coronavirus pandemic. The president of Nigeria, Muhammadu Buhari, gave the keynote address where he appealed to lawyers to ensure speedy delivery of justice, condemning multiple and conflicting court rulings. He was represented by the vice president and a senior advocate of Nigeria, Professor Yemi Osinbajo, present as well, were the incoming and outgoing executives of the NBA, senior members of the bar and bench, among others. Now, samples of 23 senior secondary school students out of 700 tested in Bayelsa State have returned positive. Now, according to a member of the COVID-19 task force in the state, the students will continue their WAEC examinations, but have been separated from other students for fear of transmission. Here's more from our correspondent in Yenagoa, Dobra Timiwood.
The number of active cases for the coronavirus in Bayelsa State as at this morning stands at 31. Now, the number has risen from 7 to 31, and Bayelsa State experienced 2 weeks where the numbers did not experience any significant increase. We spoke with the head of public health in Bayelsa State on the reasons behind this increase, and here's what he said.
As a state, we decided that as the students of the secondary schools are returning to school to write their exams, those exiting students, that it was good that we also retested all of them to be sure of their COVID-19 status. So that at the end of the day, we'll take a decision of isolating those people who are positive from the rest of the students and staff and the rest of the school community, and put them in an in-school isolation facility where they're separated from the rest of the students, and also to ensure that they can also write their exam. And so we've tested close to 700 students, and out of all of that, we've had close to 23 positive COVID-19 tests. All of those students so far have been engaged with, they've been counseled, and they've been separated from the rest of the students in the school. So there's actually no cause for alarm. Their exams were not disrupted because we also ensured that in isolation they were also writing all of their exams.
The Bayelsa State COVID-19 task force also called for calm asking residents of Bayelsa State not to panic, that they're on top of the process and they believe that the numbers will not skyrocket. As of today, there are 378 confirmed cases for the coronavirus in Bayelsa State, and out of that, 326 persons have already been discharged. The state has experienced 21 deaths. From Yenegua, Dobra, Timiwood, for COVID-19 updates.
Over in Kaduna State, schools are already preparing ahead, setting up isolation rooms within their premises where students who show symptoms of COVID-19 will be evacuated to continue their papers. Now, this is to ensure that such students whose health or behavior have been disrupted does not in any way affect others. The government says it also distributed free face masks, infrared thermometers, hand-washing basins to schools across the state before the commencement of the WAEC. Although no outbreak of coronavirus has been recorded since the exam started about 2 weeks ago in all the schools, staff as well, they're being encouraged to continue to practice the precautionary measures.
As you can see, there is great compliance of the COVID-19 guidelines. Our students come in early morning, they wash their hands, they use the sanitizer, and when you go to the class, you will see the spacing. The distancing is really maintained. The government has supplied the face masks, so every student has been given. There is no way a student will not wear a face mask. You cannot say he doesn't have, because we make sure we give it to every student. We have a class. We have converted a class into our isolation room. In case we met a student with a temperature, we'll get his paper and the student to that room to write the exam. We don't have any medical personnel, only that we have a health mistress that goes around to make sure that the students are fit.
Still in the northern part of the country, in Gombe State, the governor, Inuwa Yahaya, has commissioned a molecular diagnostic laboratory with PCR equipment at the state specialist hospital to strengthen its fight against the coronavirus pandemic. According to him, it's a proactive measure to gain positive outcomes against the disease.
Either in Abuja or Jos or anywhere else, we can now test here. And you have the records, and NCDC has it too, that Gombe has so far tested close to 12,000 samples. But with this one now, we can double that in a matter of days. So we shall continuously test, because the success of managing COVID depends on the numbers that you test. So we'll test more day by day, and inshallah we shall manage COVID better than before. We had to buy the machines from overseas, and coming here took a lot of time because of the lockdown, but nonetheless it came, and it's better late than never. At least we have it now. It cost about 121 million naira to bring it and put it up here.
Mr. Jean Njab is a medical laboratory scientist, and he joins us from Abuja studio. So I'd like to thank you for joining us on the program.
It's a pleasure to be here. Thank you.
Let's start with your observation on the expansion of community testing for COVID-19, especially in the local government areas. Are you impressed at the speed, the level?
I'm impressed at the initiative. I'm impressed about the concept, but I'm more impressed about the operations. Now, it is interesting to know that most of the expansion has probably been targeted towards those areas that have high yield in terms of positivity. But what I like to see in the field is a capacity to operationalize and quickly take samples and move them to the laboratory for testing. That's exactly what I want to see. Everybody celebrating Ghana, celebrating Egypt, celebrating South Africa in terms of number of testing. What is happening in all of those countries is that the movement, the logistics about moving samples from the community to the laboratory is fast speed. And that's the component that I'd like to see fast-tracked in this process now, fast-tracked now in this process. So this is very, very important. So community spread, locating areas of high yield. That's fantastic. But let's operationalize that. Let's strengthen that. Let the state take ownership of this process and then move the logistics quickly to the molecular diagnostic laboratories.
Some states are providing local governments walk-in testing sites for increased testing capacity. They're also providing access and awareness, but surely not all at the same speed. But when you also look at perhaps the curve of the virus lately, some would say a downward trend. And, we've also been told that it's not yet uhuru, but would you say that that downward trend would add to the laxity in our preparations as we, of course, look forward to curbing and stopping the virus?
I'm happy you're calling this a downward trend, but rather I'm a little bit cautious. I don't like to call this a downward trend because I know COVID-19 virus has a reproduction ratio about 3. Reproduction ratio there simply means that with one contact person that is infected and confirmed infected, that person has capacity to pass the virus to at least 3 people. So with a virus that has a series interval about 7 days, within 7 days, you have 27 people infected. So I'm a little bit cautious here. So what I'd like to see really happen is to strengthen the contact tracing. Something happened now in Bielsa, where they tested some students. Some students were found out to be COVID-19 positive. Now I'm a little bit I'm asking myself the questions. The paper they handled, how were they handled? How were they processed? How were they kept so that nobody would contract the virus, even though I understand we had all the protocols well respected and well documented in that part of the country. But these 27 or 20, I can't remember the number now, these students, can we see the contact tracing from those numbers? And that's what we want to see to confirm that really the numbers are going down.
And that's perhaps another question is, what are the contact tracing procedures that states are using? One other thing I'd like to get your thoughts on in perhaps a few seconds is the federal government says sample collection is still low. It has capacity to test 15,000, but states are testing between 2,500 and 3,000. How can states ramp up testing?
Very simple. What I like to see now, I like to see a number of medical laboratory scientists, especially among the junior ones, those that have just graduated, they've just moved their internship. Just select and recruit among all those medical laboratory scientists. They already have the capacity. They know the environment. They know the processes. It's only to move them into the field, let them strengthen the community team in the field. They will help collect those samples in the protocol and the way they are supposed to be collected, and then ship them and move them to the testing laboratories. So if you recruit more medical laboratory scientists, especially those junior ones that already conducted their internship, there's so many of them in the country waiting for this type of opportunity, and you're going to ramp up testing, especially the collection component, which is actually the demand creation, and then you're going to see the testing ramp up.
All right, so I guess there's, getting more people, more hands on deck. Thank you so much. We appreciate your time. Dr. Jean Njab, a medical lab scientist, thank you for joining us on the program.
I appreciate it. Thank you for having me.
We'll have more on the COVID-19 updates when we return. Please stay with us. Welcome back to the program. Now let's go over to Abia State, where traders at the Ubani Ibeku ultra-modern market have commended the efforts of the Abia State government at minimizing the spread of COVID-19 through the implementation and enforcement of the precautionary protocols. But one trader is appealing to government to go beyond the enlightenment of the people and take firmer measures like shutting down the borders, limiting the number of market days to limit the spread of COVID-19.
All borders are opened, and making the market daily markets is not helping issue. People from Abuja is coming in, knowing the number of cases in Abuja. People from Lagos is coming in. Like as of yesterday, I had the number of new cases in Abia State here. Not that all of them are real in Abia State, but most of them are people from other states that comes in Abia State. Markets, people from Abuja will come home and they will enter this market. They communicate with others, whether with face mask or not. So to my own, if I'm to say, I would like our governor to take the market back to 3 days in a week.
Now joining us is Dr. Joseph Ugwaja. He's an obstetrician, gynecologist, chairman, medical advisory committee, the Nnamdi Azikiwe Teaching Hospital, Nnewi, and he joins us via Skype. Thank you for joining us on the program.
Thank you.
First, let's take a look at, if I might use the word, your constituency, and that is as chairman task force on COVID-19 of the hospital. How has the teaching hospital been faring since the outbreak of COVID-19?
Thank you very much. We've done pretty well. Our teaching hospital is strategically positioned to help in the fight against the pandemic. And so we have 3 main areas of operation. One is sensitization. The second one is surveillance. And of course, the third critical component is the case identification and treatment. And so we've embarked on sensitizing the community. So we partner with so many media houses, both electronic and newspapers and all of that, in terms of educating the people, in terms of risk identification and all of that. Again, we also are actively involved in the surveillance and the case identification, working closely with NCDC and the State Epidemiology Office, of course, with the Federal Ministry of Health. And but more importantly, as a tertiary institution, we are actively involved in case management. And so we have an isolation and treatment center where identified cases are handled. And so we have a team on ground. That team is headed by the deputy CMAC, a physician, and has infectious disease specialists, anesthesiologists, respiratory physicians, obstetricians and gynecologists, pediatricians, pharmacists, med lab scientists, and all the full complements required. And so, so far, we've been able to test about 170 people, and we've had about 25 positive cases, and these cases were well managed in the hospital.
In terms of perhaps challenges, are there anything militating against the hospital's COVID-19 fight?
Yeah, there are quite challenges. I think the foremost challenge we faced as a hospital is in terms of provision of the necessary PPEs for our people to work with. All those are thematic areas, they have challenges, but I think the key challenge here is the provision of PPE. But I think the Federal Ministry of Health has responded to us very well by increased provision of the PPEs. The PPEs, we mean the gown, the N95 face mask, the boot, the goggles, and all of that. The NCDC has also done very well. But more importantly, the role of the stakeholders, the community stakeholders. We are very lucky in this eastern part of the country. We have individuals who are interested in what the hospital is doing. And so they've continued to partner with us to ease some of the challenges we are facing. Again, another area of key challenge is our isolation and treatment center. Currently, we have just an isolation center that is 3 to 4 bedded. And so we have logistic challenge, we have space constraints. And we will appreciate an isolation center with more capacity to treat people. So these are basically the basic challenges and all of that. The healthcare workers need to be protected. And so it is the onus on us, the key players in the sector, to ensure that our people who are working, who are exposed in this fight, are adequately protected. And so that requires an immense investment and commitment to the provision of adequate PPEs. PPEs in terms of adequate in quality and adequate in quantity. And so those are some of the key challenges we are facing. But like I said, the Ministry of Health has actually responded very well to these. Another area of challenge will be in terms of logistics required in the testing. But I'm also aware that the Federal Ministry of Health has an ongoing plan to establish molecular laboratories in almost all the tertiary hospitals in the country. Now, if that happens, that would be a wonderful incentive to us to continue to do what we are doing. And so that will also ease the challenge of the logistics involved in moving samples and in testing. Thank you.
Thank you. We do appreciate your time. Thank you so much, Dr. Joseph Waja, for joining us on the program. Hopefully we can have you again and wish you all the best in your efforts to curb COVID-19.
Thank you very much.
Now, countries across Europe have been looking at different measures to allow students, teachers return safely. In England, pupils will have to wear masks in corridors and local lockdown areas. While over in Spain, they plan to use 2,000 soldiers trained in tracking to help areas identify people exposed to the virus. This is as more than 23 million people around the world have contracted COVID-19. Here's more of the global update.
Although France has been facing an increase in its coronavirus count in recent weeks, a French epidemiologist said the rise in hospitalization for COVID-19 remains under control. France has seen in recent weeks a jump in the number of new infections, with a post-lockdown 24-hour record of nearly 5,000 on Sunday. South Korea has ordered doctors in the Seoul area to return to work as they begin a 3-day strike in protest of several government proposals, including one to boost the number of doctors to deal with health crises like the COVID-19 virus. Trainee doctors have been staging ongoing walkouts, and thousands of additional doctors were due to stage a 3-day strike starting on Wednesday. A North Korean leader, Kim Jong-un, has called for prevention efforts against the coronavirus and a typhoon that's looming in the nation. An enlarged meeting of the Politburo of the Workers' Party took place on Tuesday amid a pandemic that is putting additional pressure on the North Korean economy, battered by recent border closures and flood damages. State-run television KRT on Wednesday showed Kim in a white shirt, not wearing a face mask, presiding over the meeting, laughing with officials and raising his hand to approve measures discussed. And Chile has passed the somber milestone of 400,000 coronavirus cases in the country as the South American nation gradually eases out of lockdown. As of Tuesday, Chile registered some 401,000 cases and 10,958 deaths. Outside of Santiago and its metropolitan area, residents have seen some of the stiffest lockdown restrictions lifted, but the capital still keeps some measures in place.
Well, our website, channelstv.com, has more updates on the pandemic. Take a look at it. That's www.channelstv.com. You can also see loads of other stories apart from health and politics, business, sports, Africa, in Nigeria, of course, and the rest of the world. channelstv.com. That's the program this evening. Thank you for watching. I'm Millicent Walker. Stay safe.